Hello, this is Dr. David Greene, CEO of the Arizona Pain Network. Today's topic is what you need to know about epidural injections. What exactly is an epidural injection? It's an outpatient procedure that involves placing steroid and numbing medicine into the epidural space. Epi means around, and dural means the covering of the spinal cord, so it goes around that area and the nerve roots that are getting pinched, as that's what's designed to do, is relieve pain from pinched nerves. The injection does not go into the spinal cord or into nerve roots. What are the indications for an epidural injection? Well, it's mostly for pinched nerves, so the most common reason is for a herniated disc leading to radiculopathy or sciatica, which is the burning electrical type pain going down one's arm or leg, depending on where the herniated disc is. Spinal stenosis is when arthritis leads to overgrowth of soft tissue or bony tissue and pinches on nerves as they try and get out from the spinal cord. Degenerative disc disease can also lead to inflamed nerve roots. One can have a tear in here's a disc. This is a herniated disc, and it's actually pinching on this nerve root. But you can also get simply a tear of this outer part called the annulus. That can be very painful because there are nerve endings in the outer part of the disc. So an epidural injection can help a lot with that. And then compression fractures do well with epidural injections too. There are 3 different types of epidural injections. The first is called an interlaminar epidural injection. So what you see here is some bone called the lamina on the back of the spine. Here's more lamina. So interlaminar means between the 2 lamina, the needle goes and it actually ends up in the epidural space, and this indicates steroid medication and numbing going in. Okay, these have been done since the 1950s, so for over 60 years, epidural injections have been done in the interlaminar variety. So those are the most long-lasting procedure variety. The next one is transforaminal, and that is where the needle goes on the area outside the foramen. So here's interlaminar, but when you come out here, this is where the nerve roots are coming out from the spinal canal. This is called the foramen. So when the needle goes here, that's in the transforaminal area, and this is usually where the nerve root's actually getting pinched. Okay, and so you're putting the steroid medication closer to the area of the actual problem. The next variety is called a caudal epidural injection, and this is when the needle goes into the bottom of the sacrum area. This is called the sacral hiatus. And what happens is numbing and steroid medication is injected, and it by gravity goes up into the lumbar area. It can actually get multiple areas of pain relief, because basically this is very good for spinal stenosis where multiple nerve roots may be getting pinched. So it's an indirect method of getting pain relief medication to where it's needed. So how are these epidural injections performed? Well, they're all done as an outpatient. They take about 30 minutes. They can be done under local numbing and numbing medicine through the soft tissues. You don't have to have IV sedation, although some patients do really well with that. Pain doctors will use a real-time form of X-ray called fluoroscopy. That gives the needle the most accurate chance of being in the right place. And then dye is injected to make sure that the positioning is accurate. And after the procedure, patients go home the same day, usually about an hour later. How well do epidural injections work? Well, dozens of studies have looked at the various types of epidural injections, and overall they show a 75 to 90% good to excellent results. One may need a series of 3 injections over a period of 6 weeks for maximum benefit, and that series can be repeated every few months. The numbing medicine typically kicks in right away, and the steroid may take 2 to 3 days to officially start to work, and it can last a few days to a few months possibly. Of note, when you put the steroid medication in here to relieve this pinched nerve pain, it doesn't fix anything. It just is great for pain relief. And the hope is that the body will know that this piece of disc is not supposed to be there, and it will disintegrate it. And that happens all the time. Are epidural injections FDA approved? The answer is no, not for use in the spinal canal. But this is not a bad thing. I bring it up because medications are used all the time for off-label indications. It's legal, it's often beneficial, and I gave 3 examples here. One is Neurontin, which is FDA approved as an anti-seizure medication, but it's used often off-label for nerve pain and for migraines. Lidoderm is FDA approved as a skin patch for shingles, but it's used all the time off-label for back pain and other numbing needs, such as post-surgery incisions. Propranolol is FDA approved as a high blood pressure medication, but it's used all the time off-label for performance anxiety. So just because something's off-label doesn't mean the doctor's doing something wrong. Nothing could be further from the truth. Arizona Pain Specialists has the most comprehensive pain clinics in the Valley. There are 6 locations. All the doctors are board certified. They've won the Patient's Choice Award 5 years in a row. Over 50 insurances are accepted and over 50 treatment options are offered. The number to call for treatment is 602-507-6550. And visit us on the web at preferredpaincenter.com. I'm Dr. David Greene with the Arizona Pain Network. Your pain stops here.